Hi, I'm Dr. Thomas Su, and I'm the owner and one of the surgeons at ArtLipo Plastic Surgery, where our focus is doing some of the most advanced and most beautiful liposuction anywhere in the US and the world. And I say that because we do some of the most advanced things that very few doctors anywhere do, and that's treating the arms in a high definition manner, which we call celebrity arms, which we actually came up with, as well as treating the legs for lipedema, which is something very, very few doctors do. And what I'd like to talk about is my journey in becoming a lipedema specialist, which has been over the last 5 years. And I've now treated approximately 500 to 600 patients for this very debilitating disorder, treating their lower legs from their knee area, calf, down to the ankles, some cases the thighs, and also, as you may know, the arms can be affected by lipedema, which we do also. So I am a specialist in treating the arms and legs in a way that very, very few doctors will ever be able to do. My journey actually began many years ago. If you don't know about my background, I am a cosmetic surgeon who's been doing liposuction now for about 15 years. And prior to doing that, prior to going to med school even, I was a fine arts major, and I concentrated on figure drawing, figure painting, and sculpture. So I had a lot of art in my background. And when I established my practice of ArtLipo, that name came about because I knew that I was going to be incorporating art into my specialty of liposuction. And as such, I've developed techniques that have been able to produce much more complete results, much smoother results, much more accurate results. And that's because we do everything awake and with patients participating. So when it comes to treating lipedema, I probably treated my first cases sometime maybe about 5 years ago or so. We had already been doing our celebrity arms for a few years before that, and the celebrity arms had become very popular. This is something that, again, nobody else in the entire world had done up until we did it 7 or 8 years ago, getting that high definition, intricate look of the muscles and everything, being revealed in the arms. Well, that led very naturally to treating the lower legs, which are also cylindrical, circumferential in nature, and with a lot of intricate contours. When I started treating the lower leg and ankles, I was doing things in a much more advanced way than I would say other doctors too. And when we talk about the leg and ankles, or cankles, which you'll hear me refer to, that area is done by so few cosmetic surgeons. In fact, of all the doctors out there that do liposuction, plastic surgeons and non-plastic surgeons, which there may be 2,000 to 3,000 of, there may be 100 to 200 doctors that have ever even treated the ankle area. Well, this is very important because when I say treated the area, most doctors, if they've been there, have done it only a few times. Of the doctors that treat lipedema specifically, you'll find only a handful, definitely less than 10 in the United States, that have treated hundreds and hundreds of patients. Like I said before, I've treated about 500, and I'm probably one of the the most prolific or busiest doctors in treating this area. So many doctors, even board certified plastic surgeons, probably 90% of them or so would refuse and say it can't be done, or it shouldn't be done, or there's not enough fat for most of the patients. And that's patients that I've treated that have had that experience and shared that with me. So how did I get into doing it so much? Well, 5 years ago, we probably put a few videos out of the dozen or so that I had treated that year. And through YouTube and our Facebook and our website, the next year, I think it grew to 20 or 30, the next year 50, the next year 100. Last year, 2019, we probably had 200 or more patients that came to me for treatment of their ankles, calves, and knee area, and then subsequently thigh and arms and other things too. Out of all those patients, to tell you the truth, when I first started doing it 5 years ago, I didn't even know what lipedema was. Much like many of you out there that had only recently heard about it. Well, I'd heard about it, but I didn't know that it was actually a disorder of the fat or disease of the fat. which I now know. I started doing research about 3 years ago into it because I was seeing so many people that were either asking me about it or who had lipedema. So I came about from a cosmetic angle, trying to achieve the best looking results, the most complete looking results that I could. Other doctors that I know who are specialists in treating lipedema have come from backgrounds of treating lymphatic and venous disease. Those are the things that actually cause lymphedema, which is fluid collection in the legs. And those doctors, I would say, kind of fell into it because patients with thicker legs, lower legs, were approaching them thinking that they may have lymphatic disease or venous disease. So I know this because I went and trained with Dr. Joseph Stutz, who is one of the world's leaders in research of lymphedema. In Germany, this is where lipedema has been researched the most in the last 20 years. And it's from Germany that we get most of our research. So I went and trained with Dr. Joseph Stutz back in November of 2019 to get an idea of what approach he's taking, what approach German doctors are taking, and how this all came about. Because lipedema, as you know, is one of these things that we still have so many questions about. There's just a lot of questions and things that are unanswered about where it comes from, how it affects people metabolically, and we don't have a cure except for liposuction at this point. So after training with Dr. Stutz, I found that most of the doctors in Germany have come about treating lipedema because they were lymphatic specialists. And they're the ones that were seeing patients with distended legs, sometimes it being fluid, sometimes it being fat. In any case, the doctors there are treating patients with symptoms mostly. Of my experience with Dr. Stutz, he doesn't treat anybody unless they have physical symptoms of pain or heaviness in their legs. And another thing that's quite interesting is he was very emphatic that he will never promise a patient any cosmetic benefit. Although he does produce cosmetic benefits for his patients, he doesn't promise any cosmetic benefits. He promises them definitely improvement of their symptoms, of which his patients have very significant symptoms, oftentimes stage 3 or stage 4 disease. So what I took away from coming from training with Dr. Stutz in Germany is their approach is much different. It's about treating symptoms and secondarily getting cosmetic benefits. My approach, which is quite different, comes about because of my background in cosmetic medicine, in doing liposuction, being an absolute expert, the most advanced expert in liposuction. So, whereas they treat symptoms, for years now, I've been telling patients, I can promise you these kind of results as far as the change in shape of your legs and the beauty of your legs. And I am very emphatic. I can show you, I draw out for my patients what their results are going to look like before we ever do them. Up until a few years ago, I was telling patients, your lipedema symptoms, I can't promise you anything about. We know that liposuction is a good method of getting rid of symptoms. And I was seeing at least a 90% improvement in all of my patients that had symptoms. However, what I promised was cosmetic benefits. Now that I've gone and trained with Dr. Stutz in Germany, I know that the symptomatology is a consistent benefit throughout all those patients. And now I can promise that also. So this has kind of been my journey, and the thing that's really prompted me on and made me decide to do more and more of the lower leg and ankles areas is because of the overwhelming benefit and satisfaction of the patients I've been treating. I've been doing liposuction for 15 years. We do the most amazing liposuction, like I said, in the entire country, in the world. And yet in other parts of the body, I don't have patients
Holy cow!
breaking out in tears,
goodness.
emotionally overwhelmed in a happy way when we show them the results. However, with my leg patients, whether they have lipedema or not, I would say at least 50% of them actually break down in tears of joy when we stand them up in front of the mirror immediately after and they see their leg for the first time. I hear so many of them say, oh my God, that doesn't even look like my leg. That looks like someone else's leg. It looks like a normal leg. These patients have been suffering
That's insane.
so much their entire lives, from the time that they're teenagers to young adults, all the way up until their 30s, 40s, 50s, even some patients into their 60s when I've treated them. Probably the average being around 40 years old, the majority of our patients. However, I know that from their embarrassment to not wearing certain types of clothes that are revealing, their lack of confidence and things that this has really affected them by, it makes such a huge difference when we restore their legs to looking much more normal, slim, shapely, having contoured knee, contoured ankles. These are things that are transforming, and it really is what has made me want to do more and more of it. I think that with my experience of doing thousands of cases, the arms that we do, the celebrity arms, I've done easily 1,500 cases. Our clinic has done over 2,000 cases with the other doctors. Treating so many arms has naturally given me the experience to move right into legs and do them as completely. These are areas that many doctors are saying, oh, you should never do that. It doesn't work, it's dangerous. Yet our experience has proven otherwise, that it's very safe. Almost no complications, much safer than doing liposuction under general anesthesia. We do them wide awake on our patients. And that is the key, doing it wide awake, having our patients participatory, holding their arms in certain tense fashions. I can do the same thing with the legs, turning at this angle, that angle, having the patients tighten their legs so that we can feel and control that fat in a much different, much more advanced way than we can with patients asleep. So this is kind of the story of my progression to becoming a lipedema specialist. I only see myself becoming more and more involved in treating lipedema patients because for the last 5 years it's made such a difference to the patients I've treated, and I love doing it. So I welcome you to watch all the other videos in our series. Watch the patient's immediate before and after videos, which we've been doing for a number of years now, both in the arms and also the lower leg areas. And I think you'll be amazed at what you see. And it's actually surprisingly quite tolerable. It's not a painful procedure. So if you're interested, please send us a contact form, and I would love to get your photographs where I can draw on them and send them back to you and show you exactly what we can treat. So thank you for watching.